Smokers urged to switch to e-cigarettes by British medical group. Taking a stance sharply at odds with most American public health officials, a major British medical organization urged smokers to switch to electronic cigarettes, saying they are the best hope in generations for people addicted to tobacco cigarettes to quit. The recommendation, laid out in a report published Thursday by the Royal College of Physicians, summarizes the growing body of science on e-cigarettes and finds that their benefits far outweigh the potential harms. It concludes resoundingly that, at least so far, the devices are helping people more than harming them, and that the worries about them, including that using them will lead young people to eventually start smoking traditional cigarettes, have not come to pass. This is the first genuinely new way of helping people stop smoking that has come along in decades, said John Britton, director of the UK Centre for Tobacco and Alcohol Studies at the University of Nottingham, who led the committee that produced the report. E-cigarettes, he said, had the potential to help half or more of all smokers get off cigarettes. That's a huge health benefit, bigger than just about any medical intervention. That conclusion is likely to be controversial in the United States, where arguments about e-cigarettes have jolted the traditionally low-key public health community. E-cigarettes deliver nicotine without the harmful tar and chemicals that cause cancer. Some public health experts see e-cigarettes as the first real chance in years for 40 million addicted Americans to quit. But others, including the Federal Centers for Disease Control and Prevention, have focused on the potential dangers of e-cigarettes, for example that they could extend smoking habits, that they could be a gateway to traditional cigarettes for children, or that their vapor could turn out to have long-term health effects. These guys, in my view, are going off a cliff, said Stanton A. Glantz, a professor of medicine at the University of California who has been outspoken in his criticism of e-cigarettes. They are taking England into a series of policies that 5 years from now they all will really regret. They are turning England into this giant experiment on behalf of the tobacco industry. But some American public health experts applauded the report, saying the emphasis on policies that reduce harm, such as recommending that smokers try e-cigarettes or giving clean needles to drug users, would probably save more lives. This is two countries taking pretty much diametrically opposed positions, said Kenneth E. Warner, a professor of public health at the University of Michigan School of Public Health. One is focused exclusively on the hypothetical risks, none of which have been established. The other is focusing on potential benefits. He added, the British are saying, let's see how we can help the main smokers today, who by the way are largely poor and less educated. And let's not focus so much on kids, who may or may not be sickened by this 40 years down the line.